In the second part of Chapter 2, we are going to discuss the classification of injuries. The body is composed of numerous commonly injured anatomical structures. Before we talked about injuries such as acute and chronic injuries. Well, there are also two additional categories within acute and chronic injuries. These are soft and bony tissue injuries. Soft tissue and bone injuries are acute and chronic and further break down into numerous classifications. Let's start to go through these classifications. A sprain is an injury to a ligament in which the ligamentous fibers are stretched or torn. Typically, this is caused by a sudden acute mechanism of injury such as a shear force or twisting, like an ankle sprain, or pulling apart or a tension force of a joint. In this type of injury, a ligament can be stretched or completely torn. When it is completely torn, it is referred to as being ruptured. However, not all fibers in a single ligament are always ruptured. A single injured ligament may have intact, stretched, or torn fibers at the same time. After a sprain, the damaged ligament and resultant scar tissue are not strong enough to withstand the normal stresses that are typically placed on the body part or the joint. Therefore, it is very common for athletes to have subsequent injuries occur at the same ligament, such as an ankle sprain. Within sprains, there are three classifications. So this is based off of severity. So we have grade 1 sprains. Grade 1 sprains are when ligaments are stretched, but ligamentous fibers are not necessarily torn. A grade 2 sprain. These sprains occur when many of the ligament's fibers are completely torn, yet some may remain intact. Lastly, a third degree or grade 3 sprain. These are the most severe sprains, and this is when the ligament is completely ruptured and the tissue is entirely torn. A strain is different. A strain is an injury to a muscle, tendon, or most commonly at the musculotendinous junction. This is where the muscle and tendon meet. The muscle and tendon fibers may be stretched or torn. Sometimes, not all fibers in one muscle or tendon are necessarily affected. Typically, a strain is caused by a sudden muscle stretch while at rest or a quick, forceful muscle contraction. Similar to strains, sprains are classified into the 3 degrees previously described. A tendinopathy is a term describing an injury to the tendons. The injuries include tendinitis, tenosynovitis, and tendinosis. Tendinitis is an inflammatory condition of the tendon, whereas tenosynovitis is an inflammatory condition of the synovial sheath around the tendon. Lastly, tendinosis is tendon degeneration, or the breakdown of the tendon. Similarly, across these 3 different injuries, the signs and symptoms of tendinopathies include pain during activity that decreases after activity or while at rest, crepitus or a crackling feeling within the area, loss of motion, swelling, and point tenderness. Typically, these injuries are caused by acute and chronic methods. An acute mechanism of injury includes a sudden contraction or stretch of the tendon. This is very common to what we see with a strain mechanism of injury. More commonly, the mechanism of injury for tendinitis and tenosynovitis is microtrauma that occurs over time or after repetitive use. Another soft tissue injury is a muscle spasm. A muscle spasm, or what is commonly referred to as a muscle cramp, are involuntary contractions of the muscles. The muscles become stiff and hard, which result in pain and loss of range of motion in that area. When a joint, muscle, or bone is injured, the surrounding muscle involuntarily contracts in order to protect that area from being further harmed. A direct blow to a muscle, a sudden forceful movement, or overuse of a muscle are typical mechanisms of injury for a muscle spasm. They can also occur if a body part remains in a still position over time, such as when you're sleeping in the same position or you're potentially holding a body part awkwardly in the same position for hours. Muscle spasms can also occur from dehydration and lack of electrolytes in the body. If a person is not adequately hydrated and have enough electrolytes before exercise, they may succumb to muscle cramping, which is referred in this specific situation as a heat-related illness. Contusions, or what we refer to as typically a bruise, is caused by a compressive force. Typically, this force originates from an object compressing a muscle against the underlying bone. The contusion severity depends on a multitude of factors, including the size and speed of the object striking the muscle, as well as the size, thickness, and strength of the muscle. Typically, when we have a muscle contusion, signs and symptoms include similar signs and symptoms of sprains and strains. These include pain, redness, increase in tissue temperature, swelling, loss of function. These are typically seen right after injury. Sometimes we may even see a hematoma, which is blood from damaged bleeding tissues and capillaries. This blood accumulates around the muscle and underneath the skin. Bursitis. Bursitis is a type of injury that affects the bursa. Bursa are fluid-filled sacs located throughout the body. They assist with shock absorption and decrease the friction between various anatomical structures in the body, such as ligaments, tendons, bones, and the skin. Commonly injured bursa around the body include the prepatellar bursa at the knee, olecranon bursa at the elbow, and the trochanteric bursa at the hip. Bursa can be injured in either an acute or chronic manner. Acute bursitis is caused by a direct forceful blow to the body. Additionally, bursitis can occur through chronic mechanisms. Chronic mechanisms are those that are repetitive in nature, where it occurs from overusing a muscle or tendon, repetitive friction in the area of the skin over the bursa. In these chronic cases, the signs and symptoms of injury are similar to those of acute bursitis. However, instead of appearing initially right after the injury occurs or the impact occurs, they appear slowly, perhaps over a couple hours or several days. In addition, the swelling is more generalized compared to what you see in the picture, something more acute in that one area. Let's move on to bone injuries. Most common bone injuries are fractures. We'll spend the rest of the time looking at different types of fractures. Fractures are a break in bone and is caused by compression, tension, and shear forces. These usually do not occur as a single injury. Often, another injury exists along with the fractures, such as a ligament rupture, muscle contusion or strain, and nerve and blood vessel injury. Typical signs and symptoms of fractures include pain, swelling, loss of function, redness, and increase in tissue temperature. These fractures fractures in general, can be classified as open or closed. Open fracture occurs when the broken bones open fractures are those when the bone breaks through the skin or protrudes through the skin and creates an open wound. Closed fractures are those which occur when the broken bones do not protrude through the skin. They can also be classified as displaced or non-displaced. Fractures that are displaced have bone ends that are not in proper alignment with each other. If the ends of the bones remain in alignment, then the fracture is referred to as non-displaced. Typically, when fractures are open, they are also displaced. Closed fractures, however, can be displaced or non-displaced. Lastly, we have the classification of complete or incomplete. Fractures can occur through the entire bone, creating two or more separate pieces. This is what we refer to as a complete fracture. An incomplete fracture is when the fracture line does not pass through the entire bone, which leaves part of the bone intact. Let's now look at some specific fractures. A transverse fracture is a complete fracture with a fracture line that is perpendicular to the long axis of the bone. This is the second picture from the left. An oblique fracture, which is next to it here, is similar to a transverse fracture line, except that it runs in a diagonal pattern along the bone's long axis. Third, we have a green stick type of fracture. This type of fracture typically occurs in young children whose bones are not typically finished growing and have not entirely hardened. Therefore, it is not a full or a complete fracture. It is an incomplete fracture where it only goes through part of the bone. Next, we have a comminuted fracture. A comminuted fracture is a complete fracture with numerous tiny pieces. These bone fragments are floating around in the space between the ends of the bones, and they can dislodge and move to other places of the body. And last, we have impacted fractures or compression fractures, and these occur when stress is applied to the ends of the long bones. Other types of fractures that we have include spiral fractures. Spiral fractures occur as a result of torsion and compression forces. Avulsion fractures occur when a piece of bone is pulled off the main bone by a ligament or a tendon. When a torsion stress occurs at the joint, the ligament or tendon sometimes can withstand the force. Consequently, the ligament or tendon pulls the bone from its attachment, creating this fracture, literally pulls away part of the bone. Third, we have a stress fracture, and this is a fracture that occurs from repetitive or atypical stress over a period of time. Stress fractures typically occur in weight-bearing bones due to the force continually placed on them by an individual contacting the ground or another surface in a very repetitive and consistent manner. Lastly, we have epiphyseal fractures. Epiphyseal fractures can be dangerous if they occur in young children. The epiphysis part of the bone is at the end of the bone where a new bone is formed. This is what we typically refer to as growth plates. If this part of the bone is fractured in a child, the fracture may disrupt the osteoblast or bone forming and osteoclast, or which is the bone breakdown activity. Consequently, the bone may stop growing and close prematurely, creating a shortened limb on that side of the body. Lastly, let's talk about joint injuries, specifically dislocations and subluxations. Dislocations or luxations are acute joint injuries that occur when one end of the bone is forced out of its normal position relative to the other bone. You can see this in this picture here, where those bones are not in alignment, or here on the right-hand side where that bone is not in alignment. Typical mechanisms for a dislocation include direct blow to the joint by an outside force or force created by the athlete's body, along with the bones moving in a manner in which they are unaccustomed or not normal. Typical areas that we see dislocations include the shoulder, the knee or patella, and fingers. Signs and symptoms often include obvious deformity, disfigurement, swelling, a complaint by the athlete that they cannot move the joint, significant pain, and possibly some sensation loss. The unfortunate part of dislocations is when an athlete has one dislocation, it is very possible that another dislocation will occur because the initial dislocation causes everything to be stretched out, including the capsule, ligaments, tendons, and muscles around that joint. The other part to a joint injury in dislocations and subluxations is subluxation. Subluxations occur when a bone within a joint moves out of normal alignment, similar to a luxation or a dislocation, but then it spontaneously moves back into normal position. These occur from similar forces of dislocations, an outside force such as a direct blow from an object, or an internal force such as a forceful muscle contraction. However, unlike dislocations, Subluxations can be acute or chronic. Typically, the mechanisms are the same for acute subluxations as they are for dislocations. We see very similar signs and symptoms as well. Signs and symptoms include pain, point tenderness, loss of function, swelling, and possible loss of sensation. The big difference is with a subluxation that we do not see deformity that we do with dislocations.